So ulcerative colitis is a different condition very much from Crohn's disease. Because ulcerative colitis starts at the lowest end of the colon and the rectum, and then very sort of slowly travels directly up. The advantage to this is that it's often quite localized, and so we can use more local treatments. So we can use cleverly designed suppositories, for example, whether that be herbal or whether that be pharmaceutical, and target the tissue specifically rather than having to do as much systemic treatment. And so, when we look at the pharmaceuticals, for example, a pharmaceutical that's used systemically will have systemic activity, and so will have the potential for systemic side effects. Whereas with colitis, because we know exactly where the disease is and we can reach it, we can use these really nice topical localized treatments that reduces the risk for systemic side effects. So the definitive test for inflammatory bowel diseases is a colonoscopy and an endoscopy as well, which is where we're going from the mouth down, or a esophageal gastroendoscopy. But there are some non-invasive tests that have been developed, and so we can look at fecal inflammatory markers, for example, and we can look at certain blood inflammatory markers as well as a way to monitor disease activity and really kind of hone in on whether or not our treatments are being effective or not. However, there is still requiring the actual visualization of the tissues with the endoscopy, the upper endoscopy or the lower endoscopy or the colonoscopy, for a definitive diagnosis.